I started this program in 1996. We're very proud of what we've accomplished in the years since then, helping thousands of patients to lose weight, keep it off, and better their lives. Our goal is to fit the right operation to you and you to the right operation so that you can have the best long-term success, and then be there to support you all along the way. My dad was significantly overweight his whole life. I think he died early because of it. And I think that's part of what allowed me to get involved in this field. And this seemed like a natural fit, a way to help people with weight loss, a way to be involved in stomach and esophagus. And I've been doing surgery for weight loss for 12 years. I've operated on thousands of patients with really great success. At the time, laparoscopic surgery had not yet been applied to weight loss surgery, and I felt that this was an especially important place. Avoiding cutting through the abdominal wall in someone who's overweight could decrease the complications of wound problems, hernias, etc. that would come for it. So, taking my understanding about the problem of being overweight, taking my interest in the stomach and esophagus, and my expertise in minimally invasive surgery, this was a perfect and natural blend for me to bring together.
I started out going into surgery because when I was exposed to it in medical school, I thought it was something very fun. And I could see myself doing this day after day and walking home tired but happy. What came later was the gratification that you feel as a surgeon helping people.
When I began working as an attending surgeon about 11 years ago, I became very intrigued and interested in the field of weight loss or bariatric surgery because of its overlap with endocrine surgery. Endocrine surgery is a specialty that deals with disorders of the endocrine system, so glands that make hormones such as the thyroid gland, the adrenal gland, and the pancreas gland. And there's a natural overlap with bariatric surgery and endocrine surgery, and that's how I elected to pursue bariatric surgery.
Bariatric operations are advanced laparoscopic operations, so technically I find them challenging at times, but also fun to do.
Perfect. Okay.
I think the other thing is bariatric surgery, you're more likely to encounter women who are interested in weight loss, especially women who maybe have had some children and gained some weight and haven't been able to lose it. And I think that you can really impact their lives. And for several women, they feel, I think, a little bit instantly at ease when they walk in and they find out, oh, I'm a woman.
Our program is located at the Columbia University Medical Center of NewYork-Presbyterian Hospital. NewYork-Presbyterian is one of the best hospitals in the country. Columbia University is one of the best medical schools in the country. And the combined benefit of those things to you is dramatic.
Beyond the fact that we have the technology to take care of sick people, we also just have very experienced practitioners in all fields of medicine, not just surgery. So we feel comfortable, at least I feel very comfortable, that if I have a patient who comes in and has, say, some complex cardiac issue, that I'll be able to easily find a practitioner here who can sort of assist me in taking care of them both preoperatively and postoperatively.
It's really how bariatric surgery or weight loss surgery should be practiced. We should have a comprehensive team. It's not just surgery. I always say it's 10% surgery and it's 90% preparation and follow-up care. And the nurse practitioners, the dietitians are integral in the care. I'm not saying I don't have a little to do with it, but it really is just a little. The team really is important.
He's in GHI?
He's in GHI.
I think another advantage to working with such a large group of people is that you always have coverage. So whenever, 2 or 3 of us could be out of town, but you're always assured that there's somebody who is here in the hospital to take care of the patients, whoever they belong to, because they really belong to all of us.
If one surgeon is unavailable, for example, if they're in the operating room and cannot take a phone call, there's always an individual that will be able to return a phone call to a patient to provide information or to answer a question.
We offer the newest procedures and the best follow-up for patients that is available. We offer a patient-centered program. We have nurse practitioners, nutritionists, not only surgeons, to take care of you before and for life after surgery.
Prospective patients, either recruited by their friends, their family, the internet, the newspaper, they call the number and they are invited to an introductory seminar, which of course can be online or in person. You got to know what you're getting into to make a good informed decision. And you have to know what the decisions are. what the different types of surgeries are, and what they're going to mean to you before and especially after surgery. Once a patient's been educated in the introductory seminar, they go on to be educated further by each of the practitioners. Every patient sees a dietitian who specializes only in bariatric surgery. These dietitians go through in great detail exactly how to eat, exactly what to eat, exactly how you're going to feel after surgery, and exactly how you're going to succeed with the surgery. From there, patient goes, has all the preoperative testing they need that's been determined by their history, by the nurse practitioner. They meet with the surgeon of their choice. The surgeon will review the expectations of the weight loss surgery that you've chosen, the risks, the goals, and the lifestyle changes necessary for success. After meeting with the surgeon, if everything is in place, and most of the time it is, you get a date. You get a date for surgery.
Our goal is to help the patient be educated to choose the right procedure for them and to support them through the weight loss and long-term success afterwards. We offer adjustable gastric banding, we offer gastric bypass, we offer sleeve gastrectomy, and biliopancreatic diversion or duodenal switch. All these procedures are performed minimally invasively.
What we have to offer is excellent surgeons in a university setting, the surgeons that teach the other surgeons how to do this. You're getting a wealth of research as well. Sometimes there are doubts among patients about going to universities where there are residents, students in training. I actually think this is a huge advantage. It gives us accountability. It gets a lot of attention on you, a lot of eyeballs on you. And I think in this surgery in particular, with this patient group in particular, the more eyeballs, the better.
Surgery for weight loss not only improves quality of life, which we knew already, but improves survival, so people live longer when they have this surgery. It improves all sorts of medical problems. Diabetes goes away in the majority of people. High blood pressure gets better in at least half. Sleep problems, fertility problems. We now know that cancer risk is increased in people who have significant overweight and can be decreased with these operations causing long-term weight loss.
The surgeons in the Weight Loss Center, there are just so many of us, and I think we bring a wide variety of expertise. Individually, we're each superb, and then when you bring us together, that we all learn from one another and we work together.
That is what makes our program stand above other programs, is the sense of teamwork and collaboration, which is extremely important for a good, successful patient outcome.
It's not just a surgery. It's a whole lifestyle change.
This is a big step. We recognize that, and we're here to help you all along the way.